Next, there are warnings that cuts in mental health treatments are putting patients and the public at risk. Unions say that some parts of the East Midlands are facing a 25% cut in the number of mental health workers who treat some of the most vulnerable people in our society. Chris Doidge has been taking a closer look.
In Ripley in Derbyshire, Jonathan tells me about his experience of getting help for mental illness.
You seem to go in and they've got one key worker. Sorry, that key worker's off, is on holiday, or they change your key worker. So you've got to go through your life story again and again. And it's happened this year about 3 times already, and it's only, March.
Many of the charities helping people with mental illness have found their funding squeezed.
Derby City Council have taken off all of the funding that they gave us. That's caused me quite a lot of operational difficulties. So we are going to have to reduce the amount of work that we can take out, so the amount of involvement that we've had.
In the last 4 years, there have been cuts across the mental health sector. Firstly, local councils have reduced their grant funding for groups like Derbyshire Voice. And secondly, in the NHS, mental health trusts have had to reduce the number of beds available because of the financial pressure that they're under.
Among the mental health units in trouble in recent years, the Bradgate unit at the Glenfield Hospital in Leicester. After several bad reports from the Care Quality Commission, there are, health bosses say, signs of improvement.
I went and did a shift last week on one of the wards, and I was really pleased to see some of the improvements that have been made. I'm a doctor by background and I'm a psychiatrist by background, and so it's really heartening to see the improvements that have been made.
Some of the comments that the CQC have made about Bradgate, they are so serious and important that you wonder whether a health trust should have identified some of those problems itself.
I agree. We collect hundreds of pieces of information, and we're doing so, but we've really got to focus on the really important pieces of information about what are our patients saying about the services and what are our staff saying about the services. Would they recommend their services to their friends and family?
Savings in the NHS partly depend on councils tackling mental illness earlier. But in Nottinghamshire, there are fears that the opposite will happen.
What the council is planning to do is cut by 25% all social care jobs in mental health. That's a quarter of all jobs won't be there when these cuts come through. So that's a dramatic cut in the service.
Demographic changes and better awareness mean mental health is becoming a bigger and bigger issue. But in the East Midlands, as in the UK more widely, the funding for mental health is not keeping pace.
Well, Nottinghamshire County Council told us that they're prioritising mental health services with £10 million dedicated to it next year. But they also say that they're having to make cuts to services for vulnerable people because of government cutbacks. And it's an issue that Mark Sims knows all about. Mark, you're the Chief Executive of the Derbyshire-based P3 charity, which works with vulnerable people. Can you just spell out some of the problems that you have to handle in dealing with mental health patients?
Yeah. The simple truth of it is that these cuts are impacting very harshly on people with mental health problems from 2 angles. One, the welfare benefit reform and the impact that that's having, which you touched on earlier in the show, but also the cuts that are happening at local authority to social care. There's no requirement to support the vulnerable. There's no statutory There's no statutory duty to support vulnerable people. There are statutory duties to do other things, but if you are simply someone vulnerable with a set of needs, there's no statutory requirement to meet your needs.
OK, and what sort of problems are we talking about with people that need this sort of treatment?
We're talking about people who present with multiple and complex needs, people who sometimes get letters and stuff that they don't understand. They fall into arrears with their rent, and it's just a downward spiral because there's no safety net to stop that happening.
No safety net.
No safety net.
OK. Stephen Doyle, can I bring you in here? Because this won't come as a huge surprise to you, will you? Because of the report that your own committee, the Health Select Committee, published last year. And I quote here, it said the situation was so bad it was described as an infringement of patients' human rights. Now, what did you mean by that in your committee?
Well, we published several reports on mental health services. The particular context, I think, of the phrase infringement of human rights relates to the abuse which sometimes arises of sectioning powers. The mental health law allows the NHS to treat people who are mentally ill compulsorily in some very closely defined circumstances, and occasionally we were concerned that psychiatrists have been abusing that power to subject people to compulsory medical treatment, that's to say to section them under the Mental Health Act. That was the abuse of human rights. What I agree with Mark about is the need to ensure that there's proper provision in the community to enable people to lead lives. No.
I mean, this is the picture that's being painted by Mark, isn't it? Because of the impact, I assume, of local authority cuts and other cuts in the health service.
And it's why the government has introduced what's known as the Better Care Fund, which is doing something that health ministers have talked about over half a century, which is to make the health service and the social care system work more closely together to join them up in order to deliver better care for elderly people and for other people who suffer from mental illness.
Is this a picture you recognise?
Well, what George Osborne and the Tories are doing, these are the sneaky NHS cuts, and the cuts next year are going to be bigger than this year, and the cuts the year after,
sneaky cuts?
Bigger still. They say they're not cutting the NHS. These are massive cuts. Local authorities will have to cut even more next year and even more the year after that. This is precisely what's going to get cut.
OK, are they sneaky cuts? Are they underhand?
Well, what we are doing is carrying out what from the Health Select Committee we have dubbed the Nicholson Challenge. It's actually, once again, something that we inherited. It was first set out in 2009 by Andy Burnham when he was Health Secretary. The resources available to the health and care system are certainly more constrained than they were in the last decade. And that's precisely why we need to address some of these, to join these services up so that people don't fall down the cracks in the way that was illustrated in your film.
Is that the magic bullet?
Loads of people are falling through the cracks, but far more will next year. And for families who've got someone with mental health problems who needs that treatment, in the next 2 years, it's going to be horrendous. This is where the big NHS cuts are, and the government's not prepared to be honest and allow the public to have a debate about it. They're claiming there's no cuts. These are massive cuts, and mental health's taking the brunt of them.
Well, we're having that debate now. I mean, Mark, since what's your reaction to what you're hearing, and what impact do you think it'll have going forward?
Well, I don't think there are cracks appearing. I think there are great big crevices opening. Enormous crevices. You're talking where local authorities are cutting voluntary sector funding that supports vulnerable people by 80, and you heard from Catherine Ingram, 100% in some cases. I mean, where are these people going to go? We are often the last stop, not the first stop.
So how serious are some of the cases you're dealing with now?
We're talking sometimes about families who are in real chaos, and sometimes it's very small interventions that prevent that chaos, where we can link them into support and we can link them into more solid structures of how to live and survive. But what happens is the support that we provide and organisations like us, when that's taken away, people try and access that support through the healthcare system into a system like Stephen was talking about, and puts those systems under more pressure. It's a downward spiral.
OK, well, Stephen, you're not without influence. I mean, you're a former health secretary, you're chairman of this highly influential committee of MPs. You have the ear of the Prime Minister. What can be done to sort him?
Well, it's why the Health Committee we're actually doing a review at this moment of the child and adolescent mental health services, because I think Mark would agree that some of the biggest problems in the mental health world are to be found in those services for children and adolescents, and in particular when they leave the child and adolescent service and go into the adult service. So making certain that at a time when resources are more constrained than they were, and there's no point denying that, it's clearly true and likely to remain true after the election, whatever the result of the election. That's why it's so important for us to ensure that the services are properly designed to avoid people falling between different elements of the service.
I mean, Stephen's got a point here. I mean, money is tight, isn't it? And mental health, surely it's always been the Cinderella service of the health service.
And it's going to become more so over the next 2 years, because where will these people end up? On the streets, in crime, in prison, those kind of problems. So eventually we'll all have to pay for it. This is the wrong kind of cut. They shouldn't be making these cuts. Actually, and vulnerable people are going to be terribly hurt over the next 2 years.
The argument, in a sense, is stronger than that. So often they don't end up where you say. Where they actually end up is in acute hospitals when they don't need to. and it's by improving the community services, using the voluntary sector, links with the voluntary sector, but also with the statutory services in the community, that we can enable people to lead better lives outside hospital.
Very
rather
quick.
than
Let's
clogging
bring
up
it
the
finally.
hospitals.
Mark, what do you think about the debate
agree,
you've heard?
but it's a bit smoke and mirrors. We do need to get people to support.
Smoke and mirrors.
Absolutely.
We'll have to leave it there, I'm afraid.